Welcome to the CHCI Fall Health Summit panel, Hablemos, Mental Health in the Latino Community. This session is possible due to the gracious contributions from our sponsor, Anthem. Our panel host is Congresswoman Grace F. Napolitano, representing California's 32nd Congressional District. Congresswoman Napolitano is the highest-ranking California member and Hispanic member of the U.S. House Committee on Transportation and Infrastructure, where she currently serves as chairwoman on the Subcommittee on Water Resources and Environment. Welcome remarks will be provided by Dr. Laura Herrera Scott, Vice President of Population Health at Anthem. Our moderator for today's session is an emergency physician, professor of health policy and management at George Washington University, CNN medical analyst, a non-resident senior fellow at the Brookings Institution, and former Baltimore's health commissioner, Dr. Lina Wen. She is also a contributing columnist for the Washington Post and recently released her memoir, Lifelines, A Doctor's Journey in the Fight for Public Health. Please welcome our opening remarks speaker, Congresswoman Grace F. Napolitano, followed by Dr. Laura Herrera Scott.
Hello, I am Congresswoman Grace Napolitano, and I proudly represent the California's 32nd District. Thank you to CHCI for putting on today's briefing and for inviting me to participate. Now is the time to continue to raise public awareness about mental health and encourage those in need to seek help. It is vital that we educate our Latino community on this very important issue and reduce stigma. We have come a long way in making mental health a priority in Congress and at that state and county and local level, but mental health still remains underfunded and misunderstood and still affects millions of people. This is largely due to long-standing stigma and health disparities, and of course COVID is also worsening the existing mental health crisis. We see and hear it on news, TV, etc. If we address stigma with service early, we can help students and families of color succeed. It is very critical that we provide schools the resources to create a mental health plan in schools to help the students during this stressful time and beyond. I know this firsthand from my decades of direct local involvement. In 2001, after learning that 1 in 3 Latina adolescents had contemplated suicide, I secured $500,000 in federal funding from SAMHSA for a pilot program that lasted until 2009. We partnered with Pacific Links in Los Angeles County and started the now successful Youth Suicide Prevention Program. The schools were very resistant at first because of stigma, but the program has grown to start 35 schools and is now funded by the Los Angeles County. It serves as a model for HR 721, the Mental Health Services for Students Act, which would provide funding for school-based programs nationwide. HR 721 passed the House in May, and we hope it comes to the Senate floor soon. Machismo and other cultural tendencies still prevent our loved ones from being open and honest about what troubles them. I have introduced HR 2529, the Mental Health for Latinos Act, to address this issue. It directs SAMHSA to develop and implement an outreach and education strategy to promote mental health in our Latino community in Spanish. We further would identify gaps in access during this pandemic and help reduce stigma. Legislation forces the message that is an absolutely zero shame in asking for help. Our work continues, but it cannot and it must not be limited to Congress. I encourage all of you, everybody, get involved. Continue to educate all your elected officials from local, state, and Congress on this very important topic. And then share your knowledge with friends and family. If you see someone who has fallen on hard times, talk with them, help them out, and refer them to mental health services. The National Suicide Prevention Lifeline is 800-273-TALK. Together we can strengthen the mental health well-being of all of our communities and eventually live in a world where there is no stigma. The new phone numbers, 988, will be in effect next July, I believe. So we hope that we'll come across so we can help everybody. Stay safe and God bless.
Good afternoon. Buenas tardes. I'm Dr. Laura Herrera Scott, Vice President of Population Health here at Anthem. Thank you to the Congressional Hispanic Caucus Institute for hosting this important panel discussion and for the opportunity to welcome you all here today. As a Latina and a physician, I have witnessed firsthand the impact that mental health and illness has on our communities and our families. The fact is, Latinos show similar vulnerabilities to mental illness as whites. However, they face disparities in both access to and quality of treatment. Compounding this are the unique barriers to care, language barriers that make it difficult to communicate with providers, cultural differences that can lead to misdiagnosis, and the stigma that it still exists in our community, making mental health a taboo subject in many households. As Latino healthcare leaders, we have an opportunity to amplify this dialogue and raise awareness among our peers to help deliver solutions that can help improve access to mental health care and achieve equity in our healthcare. At Anthem, we are fueled by our purpose to improve the health of humanity. As such, we're committed to understanding where and why barriers to health exist. Just a few examples include contracting with providers who offer specific programming to address the needs of the Latino community, providing cultural competency training for our providers to help them improve their patients' health literacy, improve their own communication techniques, as well as help them gain a deeper understanding of cultural differences that can affect accessing healthcare. Capturing languages spoken within our providers' areas of expertise so that when members are searching for providers, they can hone in on those who speak Spanish. I'm excited to hear from our panelists today and their collective insights and efforts to deliver solutions that can help improve access to healthcare, especially mental health care, in the Latino community. Thank you for joining us today.
Good afternoon, everyone. My name is Dr. Lina Wen. I'm a professor of health policy and management at George Washington University, and I am really pleased to be here today to lead a discussion for this breakout session that's titled Hablemos, Mental Health in the Latino Community during this day-long virtual health summit. First, I would like to give my thanks to Marco Davis, to Congresswoman Grace Napolitano, and to my former colleague here in Maryland, Dr. Laura Herrera Scott, for setting the tone for this discussion. And thank you also to CHCI for providing a platform to discuss the importance of mental health in the Latino community. Now, I'm personally so glad to be at this conversation because we know that mental health is a huge unmet health need. It was a huge unmet health need prior to COVID. And if anything, it has only gotten worse because there has been so much diverted attention away from other urgent health needs because we have been facing a global pandemic. For far too long, though, mental health has not been seen in the same light as physical health is, and that is to the detriment of everyone's health and well-being. As we'll be discussing today, and as all of you know, communities around the country face many barriers to access when it comes to mental health. Those barriers will include language. Those barriers will include access to services. They'll also include issues related to financial resources and insurance. And we'll be discussing these problems. But what I hope is that we'll also be talking about solutions as well and how industry leaders are working to ensure that Latinos are receiving comprehensive healthcare that very critically includes mental health. As always, we want to hear from you, our audience. And so during this discussion, I hope you'll place your comments and questions in the chat feature to the right of your screen, which I will be monitoring and will look to you for the rest of our conversation. And you can also engage in social media using the hashtag of CHCI Summit. Now, we have a great group of experts on today's panel. And as I introduce each person, each of our two panelists, could you please tell us more about yourself, your affiliation, and your journey also to be part of this conversation today? First, I am delighted to introduce you to Dr. Lisa Fortuna. Dr. Fortuna, could you please introduce yourself?
Thank you very much. It's a pleasure to be here. So I'm Dr. Lisa Fortuna, and I am currently professor and vice chair of psychiatry at the University of California in San Francisco, and chief of psychiatry here at San Francisco General Hospital. I come at this as a Latina myself of Puerto Rican heritage, and serving as a psychiatrist, a clinician in both coasts, on the East Coast until recently, and now on the West Coast, working with diverse Latino communities. I'm a adult and child and adolescent psychiatrist, and I'm also a health services researcher in really studying the area of public health access to mental health services for underserved populations, especially Latinx and immigrant populations. And so I come at this from the perspective of looking at what are the mental health services needs of the Latino Hispanic community, and also what are some of the things that we can do actually to improve access. So I really went from studying what are the barriers to really looking at what can we do in terms of interventions to improve access and quality of care, which, as we talk further, really requires a relationship with not only academia and public health, but also with communities themselves to be able to deliver that. So that's a little bit of my introduction.
Thank you very much, Dr. Fortuna. You touched upon many themes that I hope to explore much more in this conversation. And so thank you for giving us your background. Our next panelist is Dr. Irma Elisheva Diaz. Dr. Diaz, could you also introduce yourself and your journey to be part of our conversation today?
Yes, good afternoon, Dr. Wen. Good afternoon to everybody. It's a pleasure to be here. My name is Irma Diaz, and I am a proud first-generation Hispanic Angelino who wears several hats that are pertinent to our topic today. I am the Health and Mental Health Liaison for Congresswoman Grace Napolitano, who serves the 32nd Congressional District in California, which is approximately 65 to 70% Hispanic. In this position, I've had the privilege of spearheading the Congresswoman's Mental Health Consortium, which is comprised of community and mental health leaders. And it is through this vehicle that we are able to ascertain the mental health trends and the needs presented by our demographic, which I hope will be beneficial to our conversation today. I'm also a grief support facilitator for Emanate Health in the San Gabriel Valley of California, whose affiliates are 3 hospitals and a home health and hospice. In addition, I am a member of the Latinx Mental Health Advocacy Concilio in Los Angeles County, whose mission is to advocate for culturally and linguistically appropriate mental health services. It is my pleasure once again to come your way today on behalf of the Congressional Hispanic Caucus Institute, along with my distinguished fellow participants, for a topic that is really near and dear to my heart. I look forward to our time together. Hablemos.
Thank you so much, Dr. Diaz. Let me go back to Dr. Fortuna, if I may, and I'm going to direct this question to both of you, but beginning with Dr. Fortuna. I do want to start with discussing barriers. I eventually want to get to the point of talking about solutions and effective interventions. But Dr. Fortuna, could you begin by telling us what barriers exist as it relates to mental health that may contribute to Latinos not receiving the adequate help that they may need?
Yes, definitely. So, there's several, and they're at the individual and structural levels, right? So if we think about our individual people who need mental health services, and then within their own communities, we know that there are barriers in terms of stigma, in terms of people's awareness of mental health and services and needs, and what is exactly depression, what is anxiety, and it really, what are the resources that people feel comfortable accessing? And so that's one part of stigma, and as well as sort of the issues of language, insurance coverage, and that whether there are mental health services that are clinically and culturally appropriate and accessible where people live. And so those are some of the issues. The structural issues, which I also like to underline, and is a lot of sort of the focus of my research, is how do we receive and offer the appropriate services once people do come into the door? Because one of the things that I have experienced as a psychiatrist, both working with adults and children and families, is really that if families identify a resource for mental health services, for example, if they can find a bilingual, bicultural, culturally responsive system of care, they have others who have accessed those things and let them know about it, that people do come to services. And because I have found when I was working even in Boston, that once the community found out that there were those services that were appropriate, I was the most busy and filled clinician in the clinic, in terms of really being able to provide those resources. And when I moved, those Latino families tried to find me, because I think when Latino families find the services that they do want, they engage, and I actually had very sort of strong engagement. So that just really speaks to the importance of not only educating communities about what is accessible and what are mental health services, but then providing the services that are going to be acceptable and responsive to their needs. So both things are important.
I appreciate how you highlighted these individual and structural issues together, and also how you talked about, I've been thinking about this a lot in relation to COVID and the pandemic, that so often we are blaming hesitancy when actually access is the issue when it comes to vaccines. But I think that very much applies to other aspects of healthcare, including mental health as well. Dr. Diaz, could you add to this conversation about the barriers that you have seen? And if you want to add too, if there are any types of public services and policies that you have seen to be effective when directed towards Latino and other vulnerable communities.
Okay, thank you so much. So historically, we have found that that there are certain trends that come and go, but there's one in particular that I've noticed that is very prevalent right now. That which is embracing the stigma, if you will, of mental health, and that is lack of trust. And so this lack of faith in resources, this is what I have found in our community. And when there's a lack of faith in resources, it leaves our community less inclined, if you will, to lean on whatever is available. There is, rightfully understood fear. And with all the mixed messages that are conveyed, there is rightfully understood confusion. The fear of having your parents, for example, or grandparents or a loved one deported suddenly, just because you reached out for help. This lack of trust has generally driven our community, which is what I have observed on a grassroots level, further away from whatever resources that they do actually have. And of course, it happens with different entities, if you will, of the community. So, for example, as a mother, when I'm concerned, it is first for my children, then for myself. When I'm worried about my children, it's even more stressful than when I'm worried about myself. And it creates this inexplicable weight, and this weight is very hard to carry. So we can only imagine what it looks like to be fearful for the well-being and provision of those we love, and worse, the torment of the what ifs. So what if I go for help and it backfires? What if I go for help and I get fired? What if I put my family on the immigration radar? I don't want to do that. And then worse than that, what if I don't get help and they need it? God forbid. So this stress kind of what I have observed by working with the community on a grassroots, it really does exist. And that's for me, what I have seen, one of the biggest right now trends in the community on a grassroots level is lack of trust in the resources that they do hear about that are available. So what I hear Dr. Fortuna saying is good news to me. And I just hope and pray that is something that grows, because it's very difficult. So I'll stop there.
So, Dr. Diaz, can I actually follow up with you on this issue of trust? Because I think you've given us this very vivid imagery of what it would be like for someone in need who is afraid to seek help because of consequences. Are those consequences real? I mean, can you debunk these myths? I mean, what do you say to people who are afraid, as you were saying, of their families being deported if they were to seek help? I mean, how can we address these types of concerns?
Honestly, it takes cultural sensitivity. It takes the experience in knowing how to address them. So if you get someone that doesn't understand, for example, if you're speaking to a younger Latino, you would address it differently, and it probably wouldn't exist the same as it would if you're addressing a baby boomer, if you will, that is, that is concerned about certain things or protecting their family, or, so you would address it differently. So it takes educating and equipping people with cultural sensitivity, even if they're Latinos, because you have to know how to deal with the age group. You have to know how to deal with, the different ways that people believe, the traditions, the things that they hold on to tightly. It runs deep. And so I don't know if I'm, Dr. Wynn, if I'm addressing exactly what you're asking me, but it's very important to have people that are culturally sensitive, not just that speak Spanish, but that are culturally sensitive, that understand, hey, I'm in my 60s, so somebody's going to address a 60-year-old differently than somebody in their 30s. And it's going to hit different, it's going to land different, and it's going to be helpful in different ways. Does that make sense?
Definitely. And Dr. Fortuna, I'll come back to you and ask you how you address this in your clinical practice.
Yeah. I mean, I completely agree with Dr. Diaz that there is this issue of trust, right? And I fail to sort of talk about that, especially with issues of immigration, and also in other issues too, right? I mean, immigration is a very big one that is a concern for both adults and with the adolescent population that I work with too. They are afraid, right? Even if they are a little bit more oriented towards seeking mental health services, they're worried about presenting themselves because of their parent status, right? When we think about mixed status families. And it actually becomes an issue of anxiety and depression, because I worked with a lot of young people recently where the fear of separation and deportation of their parents is underlying their depression and anxiety and stress, even to the point of suicidality. And so I've worked with a lot of families grappling with that, of, sort of what Dr. Diaz is saying, like how I have to have my child have help because they're even at the point of being suicidal, but the core fear is as this mistrust of what if we do appear. So the way that we've had to do that is I have to put the onus on systems again, and structures and clinicians. And so a lot of the settings that I have been in have been safety net hospitals that provide services for public insured or uninsured, where legal status documentation is not sort of part of what we are asking about in terms of entry to services. And the clinicians where I've worked have even had to fight policies of sort of needing to have certain IDs, be able to sort of access services. I mean, we pushed back on that on behalf of the communities that might be stigmatized or mistrustful or not interested, desperately needed services. So that's one thing. How do we structurally sort of build the clinical and structural competence, right, to be able to sort of serve communities so that when they enter into those arenas, they can see that we are supporting them. And then the other piece, which I'll just talk about briefly because I can deepen the conversation on too, is I am completely with Dr. Diaz of the importance of working with communities. And so currently that's part of what I'm doing is I'm actually partnering here in the area of San Francisco with a group that's called Somos Esenciales, which is, and they call themselves the Essential Researchers, which I love. And they're participatory action researchers who are essential workers, immigrant communities that did a research project of what is the impact of COVID-19 in this time on the community. And there were two big things that they brought up in the emergence of their qualitative interviews with the community. One was mental health. They named mental health. And the second one was economic devastation, and not being able to even pay rent in this Bay Area. Right. So, and they saw the link between those things as a social determinant of their mental health and stress, and their, and their documentation status, and their employment issues, right? All interconnected and interrelated, which I said, you're absolutely right. Those things are interrelated. And so we're trying to create how to do interventions. And they said, come out to the community to do some of these interventions because that's going to provide trust. And let's do it in a culturally appropriate way. So I think that dialogue of structural and community sort of mental health services have to be with the community is salient.
I'm so glad you talked about the importance of engaging community. And Dr. Diaz, you had mentioned this earlier, and this is for both of you, your professional work. I certainly understand this too. I was the health commissioner for the city of Baltimore, and saw for myself how you cannot make assumptions about what communities need. And that trust goes both ways, right? That the trust begins with you understanding and hearing what the concerns are and then moving to address them. And so very much appreciate your mentioning this. And Dr. Fortuna, let me come back to you because you were just addressing some issues around collective trauma with COVID, with economic downturn, social upheavals. I think many people want to have some practical advice too about what are some signs that people should be looking out for among ourselves, our families, our peers, our colleagues that could signal a need for help.
Yeah. So one of the things that we found throughout this pandemic, in multiple sort of conversations with the community and the providers as well, because this is the interesting thing about this pandemic, right? Is that both the people serving, mental health needs and those who are needing it in terms of patients, clients, however we call it, are experiencing these different levels, of trauma and loss and stress. And so I try to think about it in both ways, because a lot of times the providers who are working with the Latino community sometimes are often themselves from the Latino community and experiencing deaths and loss and these are disproportionate impact. And I saw that in my colleagues who are child psychiatrists, who we were trying to sort of present something and people were crying because they're like, oh my God, I lost my mom, during this COVID pandemic for similar reasons to the clients and patients I'm working with, right? And how to manage that. So I think that the signals for all of us is when we are feeling obviously sort of symptoms of sadness and anxiety. And what we were finding is that, families and providers, but focusing on families, that they were saying that they were having a lot more sort of anger outbursts. The youth were having difficulties completing school. People were having, sort of a real sense of diminishing ability to function and be able to sort of even feel okay at work. We saw a lot of increase in alcohol use, which I think we've seen nationally, but the Latino community reported that they were concerned that people were drinking more, that there was some increase in violence and conflict in the home. And then also people were sort of very depressed and anxious and in terms of their ability to maintain their homes and economically. So all of those things, when it really starts hitting issues of functioning, and just general sense of well-being and worry about our family members, as Dr. Diaz was saying, right? Because often we find is that it's family members who can call it and say you need to come in, and I saw that a lot with men, right, who sort of really let themselves get really into a really bad state of depression, and it's often a family member that says no, I can't keep holding you up. I'm going to bring you in, right? And so it's really important for families to note that in one another and push for that extra help.
No, it's very helpful. And Dr. Diaz, can you also comment on this too? Have you also seen the impact of collective trauma over this last period, and what signs should people be looking for, but also what resources might you offer for people who are watching this?
The Latin, something came to mind as Dr. Fortuna was speaking. The Latinx Mental Health Advocacy Concilio, which is led by Dr. Luis Guzman and Carmen Perez, they recently put out a white paper that has identified some major barriers. But one of them that comes to mind, because it has to do with disconnect, is the widening of digital divide. So limited access to technology is a major barrier to mental health services for the Latino population. And, we need to improve telehealth services for Latinos by using platforms that are already familiar to them, so that they can get out. We need more funding for public Wi-Fi, especially in low-income communities. And this could, just go on and on. But for the sake of conversation, the feeling of being disconnected from help and disconnected from the community, there's something about that puts the community at a certain place, and that causes trauma. It causes that collective trauma that we're speaking about. Communication, everything has gone online. And if you can't go online, what happens? So we need to improve what's available. This is a major barrier, I would say, and causes collective trauma.
That's such an interesting point, and I think there have been a number of studies that have looked into telemedicine, which I'm a huge proponent for in general. But I think we've seen exactly what you mentioned, Dr. Diaz, which is that the early adopters and the people who benefit the most from these new technologies tend to be people who already have access to many things. And for them, it's one more nice to have. But for other people, if resources are removed and replaced by telemedicine, but now they don't have those telemedicine resources because of lack of broadband or language barriers or something else, or even knowledge that these resources exist, that exacerbates the divide. And so I think it's a reminder of how we need to be attentive to new technologies, not just that are good for some, but ideally that don't further the digital divide and other divides that you outlined. I want to turn to solutions and to interventions that you all have seen to be successful. And Dr. Diaz, let me come back to you here. Could you, I know that in the work that you do in the community, you must see many examples of successful innovations that improve mental health. Can you talk about what some of those might be, whether they are from the public sector or public-private partnerships, some things that you would want to lift up and hopefully we can scale on a national level too?
I want to give it some thought because I know we're we're limited on time, and there's so much, Dr. Wen, there's just so much. But I would say that communication and knowing one another. So in other words, if I work in the same community as Dr. Fortuna, I need to know what she does. She needs to know what I do. We need to learn, we need to partner together and become ambassadors together for mental health. And we need to support each other and come together for the community. And I think if we were looking at it from that lens first, it's very important. And I think that sometimes as mental health leaders, as advocates, that we are fragmented and the services become fragmented and there's not a lot of communication to get the resources out. And I think that one of the first steps for that would be getting to know one another, for me to know Dr. Fortuna, for her to know me, and for me to know what she offers and what she's done and her expertise, and for her to know mine, so that we have something to package and something to offer and a message to really deliver to the community. I think that that is one way to look at it, one lens. Another lens is of course from the community's perspective, and just being able to have a safe place. I don't believe that and Dr. Fortuna mentioned this, and I really am happy to hear it. But in my neck of the woods, in the district that I work in, people are not, they don't feel like they have a safe place where they can go and they can just bare their soul. And so I believe, although this may be redundant, it's important to bring it into your question in the form of an answer, is that I believe that there are some places that have offered this and it has worked, where there is a safe place, where there are people that are trained, people that are educated and equipped in being able to address the different mental health issues that arise within the community. And every community is different, so to know your community is very important. And so that would be from the lens of the community. There has to be a way, and of course, disseminating the message and being able to get that message of the resource out to the community and to communicate so that there's not such a disconnect between us is very important.
Well, I am going to turn to Dr. Fortuna next to answer this. But before I turn to her, I want to remind our audience to place your comments and questions in the chat on the right of your screen, and to also tweet us at CHCI Summit. And I'm looking forward to getting to our audience questions. I see that we already have a few, but would love to hear even more for our wonderful panelists. But Dr. Fortuna, you had mentioned at the beginning too about the successes that you've seen. Can you highlight what some of those might be, and what we might all learn from these successful interventions?
Right. So if we think about just clinical intervention, so I'll start at that level. I've done research, with colleagues that have looked at specific models, for example, of cognitive behavioral therapy, or cognitive behavioral therapy augmented with some sessions by telephone, so that people can access it at different times. We've also sort of created sort of digital interventions that are done in hybrid with sort of a culturally matched coach, right? We've done sort of school embedded interventions so that they're accessible to kids in schools. We've done interventions of cognitive behavioral therapy and other depression and anxiety treatments embedded in a model within primary care, right? So all of these things are trying to sort of create access. The one thing I can say is if you can deliver it in an accessible way, and you work with community members in the right cultural adaptation and implementation, that these interventions that we call clinical mental health actually work, because what we saw in all of those interventions is that we did improve in depression and anxiety or post-traumatic stress disorder or substance use. Whatever we were trying to treat works, right, for Latino communities. And I highlight that because people often ask me, well, does CBT work for Latinos? And yes, I mean, we have thoughts, feelings, and actions, like, which are the targets of cognitive behavioral therapy. But you do have to integrate culturally appropriate issues, including sometimes spirituality, sometimes a more sort of family focused approach rather than an individualistic approach, using sort of language and frameworks of how people understand mental health, how they understand the physicality of depression. People talk about Latinos being very sort of focused on their bodies rather than not psychologically minded. But what I tell my colleagues is, guess what? Depression is physical as well as psychological, emotional. Latinos have it right? You do feel fatigue and pain and all kinds of other things. And the pharmaceuticals know that too. So they have all this sort of, depression is painful medications, right? So, it's sort of working with the communities and understanding we can bridge, our frameworks for mental health and deliver evidence-based treatments. But part of it is implementation. Where do we put that, right? Where do we put it in places where people can access that they feel trusted? So some of the things that we have found very successful is working with churches in actually sort of integrating mental health interventions that are done collaboratively with community health workers or sort of peer coaches, right? And that can actually integrate themes of spirituality and trauma and resilience in that within sort of cognitive behavioral frameworks. That has worked. We've worked with immigrant serving organizations that provide multiple services for immigrant communities, including economic and housing, and integrated after school programs, for example, that have used evidence-based treatments, expressive arts, and other things, and family-focused therapies that are together with all of the other needs that the individuals and families need. So I think it's part sort of, there is evidence-based treatments that work with Latino communities. We have to sort of get better at implementing and allowing for the financial resources, right, for the partnerships that are required. And so that's one of the things that I'm really trying to get people to jump on the bandwagon of, how do we do these sort of multi-sector school, community-based organizations, community centers, churches, supported financially interventions, right? Of how can we reimburse those services? How can we sort of support workers who are these coaches and navigators and everything else that are from the community to have a career in helping their community in mental health? I mean, those are all things that can be legislated, right? With finances to be able to support that creativity.
And I love what you said about this idea that we are creating a new type of workforce. I mean, in the sense that we aren't, I mean, the people who are reaching out in the communities, they're not necessarily trained in the same way as a psychiatrist or a social worker is. But because of their deep community ties, the partnerships that are formed, they're able to establish trust and work with individuals in a different way. So can I direct as a final question before we go to the viewer questions? I want to get very practical and very granular once again, which is if somebody is coming to you and understanding that there may be obstacles like barriers, financial barriers or language barriers or trust and other things that you all mentioned. If somebody just says, how can I get help? You know, how if my relative, if I see that my relative has I think they're depressed or they have an alcohol use issue or something else, where do you recommend that they seek help? And I would also want you to address, if I can, and I'll start with Dr. Fortuna here too, where would you advise that they go for individuals and their families? And also for practitioners who may be facing a level of trauma themselves too.
Yep. So, I mean, one of the greatest places that I mean, I think, everyone has primary care physician, right? For the most part, or should, right? Actually, we found out that a lot of Latino communities, people don't have even a sort of ongoing primary care provider, even though they might have it for their children. If they have children, they don't have it for themselves. So I think it's really important for people first to sort of make sure that that person is linked to a primary care provider and work with that person to be able to find the right referrals around mental health services. Some primary care services have behavioral health integrated within their primary care services. And that's something that's growing and being more and more supported. And so that they can get a first touch of what they might need, including case management that might help with some of their psychosocial issues that are impacting on their mental health services. So I think the primary care providers are an excellent place for people to start. And there are a lot of safety net, public, health community centers that can offer care for people regardless of insurance and status and everything else. I think that's a critical place. If they have insurance, you can also get ideas about referral. But I think for our community, primary care is an excellent place to start. And I think that for providers too, and for the providers, a lot of workforces are having sort of employee and provider support programs that I think are critical for providers to tap in, which we have a tremendous amount of stigma as providers of saying that we are experiencing distress. But I think people really have to sort of reach out, especially as providers.
That's extremely helpful. Thank you. And Dr. Diaz, I'm going to turn the question to you while I ask our audience to submit questions as well. We're already seeing some very interesting questions coming through, which I'm excited to ask. But I would just ask you for additional thoughts about resources and avenues to seek help. And actually, one of the questions that we had is specifically about younger children and families. And if you could address that element as well about how we can what we would do to refer people to treatment, including in this case, younger children and their families too.
Well, thank you. First of all, I just wanted to kind of piggyback, if I could, off of Dr. Fortuna's comments. Is it's so important that we make all of this that's so meaningful and so productive, palatable, and not intimidating. So when you're communicating with the Latino community on a grassroots level, and you're rolling up your sleeves and you're talking to them about, their children and all of that, we have to make sure that what we are communicating to them is very, very palatable and not intimidating. And one of the things that I think has precipitated the lack of trust is that some of the ways that we package things is intimidating to them. And I know that unless I could break it down, it may not make a lot of sense, but it's very, very true. So that's very important. I also think that we need to view this as a campaign. We need to kick this off as a campaign for those of us that work as advocates or clinical practitioners to come together. And I'm just a big advocate of that, because the other day, for example, we were in a meeting with the consortium the consortium was talking about all these places where people could go for their help. And the Congresswoman was on, Congresswoman Napolitano, and she said, how are you going to get the word out? You know, what are you going to do? You're going to sit there, you're going to talk about all this, but how do you get the word out? And I think that that it's very, very important. So there are a lot of local places where people can go for help. Dr. Fortuna and I had a conversation prior to this, and we had the same list almost of the places you can go, and we are going to communicate that to the caucus so that they can go ahead and disseminate that information for everybody. But just in general terms, Dr. Wen, it's very, very important that you can have all the resources in the world, but if it's not palatable, if it's intimidating, if it's not reaching the source, the people at their level, it's not going to do anything. It's just going to be there. People are going to raise money with it. People are going to do, but it's not going to go anywhere. And that has been the most frustrating part, I think, for the consortium members as we sit and we talk and we collaborate on the different things that we can do. And so I want to say that because it's very, very important. The other thing is there is a portion of legislation that's important to talk to. It's very important that we keep in touch as leaders with our official, our elected officials in our community on a grassroots level with what we're doing, because they're the ones that write the legislation. They're the ones that can get things done. So in terms of legislation, we need to develop a voice in Congress and with our local officials, and look at the bills that are already presented and be able to support them. So I don't want to deviate, but when you asked me that, I started thinking of there's so much, it's just a plethora of ways that we can package and we can put things together, but we must come to a place where we strategize and we're able to get the word out to the person that is living in a little corner somewhere in the town that nobody pays attention to, that may not have running water, that doesn't know how to get online. We've got to be able to get to everybody, and that's the crux of the matter. And I don't know if I'm overstating here, but it's just really something that's in my heart that I have seen over and over and over and over. So very important.
Thank you. And I'm going to get to one of a few of our audience questions. The first one I'll direct back to you, Dr. Diaz, and Dr. Fortuna had touched upon this as well. But Dr. Diaz, how do you see religion and faith, which is very important to some in our communities? How do you see that play into Latino mental health practices?
Well, okay, so Latinos, as we know, are generally people of faith. Doctrinal beliefs and teachings, along with culture and tradition, play a major part in our lives, in all of our lives. And for example, does a person view themselves as needing a therapist, or do they think they have maybe some spiritual toxicity, if you will, from their upbringing that is causing their problem? The question becomes, do I need a priest, a pastor, or a rabbi, or a psychiatrist? So the next issue is, does a person think they have a lack of faith because they're not going straight to the source, which would be God, which would be their pastor, which would be their priest? Are they not trusting in prayer itself? It just depends on their doctrinal, beliefs and where they are. The situation is that many will turn to that. And I agree with Dr. Fortuna. I think that if we would partner more with spiritual leaders, with the pastors, with the priests, with the nuns, with whomever is there in the parishes leading the people in the congregation, I think that they have an influence that we don't have, that we can influence families and people that may not understand mental health. They may not understand what's available to them, but they have the voice, and they can help to lead these people and guide them into the place where they need to be to get the help that they need. And so that's very important. So we're people we're people of faith. It runs deep within us, even when you're not religious. It runs deep within you. The way you were brought up, the things you heard as a child, and so all of a sudden you need help. What do? You go to your priest. You go to your pastor. You say, "Please pray for me," right? And please help me. But if we partnered with that pastor, that priest would be able to say, "Listen, this is what I think you need to do. You need to go see Dr. Fortuna." Right? And here's why. She's a great woman. She's going to help you. She's going to da 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 da. And all of a sudden they say, "Okay, my pastor said it's okay, so I'm going to go." Right? But we need to partner with them and make them ambassadors with us for mental health. And that's very important.
That's such a thoughtful answer. I so appreciate it. Thank you. One of our other participants is asking this question that I'll direct to Dr. Fortuna, which is, how has social media impacted mental health issues, especially for young Latinos that use social media regularly?
Yeah, I mean, I think that's a double-edged sword. So social media, I think, can be used for good, and it can also perpetuate trauma, right? So some of the things that we have found is that if we look at some of the racial-based trauma that we've been experiencing in an escalated way or a very prominently visual way, right, in media, during the pandemic, including sort of police violence and anti-immigrant activity, right? What we have actually found, at least in research in child and adolescent psychiatry, is that exposure to those things, more exposure to those things in social media, is related to increased depression, anxiety, and even PTSD, post-traumatic stress symptoms in Black or African American and in Latino and immigrant youth. That watching violence and discrimination experiences against your people, right? In that kind of way, with sort of that salient sort of racism, is related to poor mental health. And the more you're exposed, we actually have seen sort of the relationship of the more you're exposed, the more you experience those negative effects. Social media, which we were trying to sort of work in some of the digital interventions that we're working with, is trying to create access and resources for youth that are focusing on wellness and mental health, and can speak to these issues and answer youth's questions, help them sort of link to resources and access and services. Like, we're doing some of that work now in building something for foster care youth who are communities of color, how they can access mental health resources and supports. And we're building an app co-created with them. So it sort of takes me back where how we really have to sort of work with young people or communities in creating these things so that they make sense, right? And it's deliverable. So social media can be used for the good and the bad. And if I can just add something about that spirituality thing real quickly, I just happen to be sort of also an ordained minister as well as a psychiatrist. So I have a sort of particular comfort, right, with listening at least to people's spiritual sort of understandings of things. And I think on our side, again, looking at providers, like, I think we have to partner with the faith community to be able to sort of support people seeing mental health services. But we're really pushing for also providers to be open to hearing those frameworks of how people understand their experiences from a physical, spiritual, as well as psychological perspective, and to work with that. And when I find that, not sort of putting doctrine or anything from my faith, obviously, but when I can hear how people are experiencing pain and depression from a spiritual perspective, then they are more open to communicating, because now you're listening to their language, right? And then you can translate that into how we can work with that from a mental health perspective and with your pastor or whoever. But you have to be able to listen, as that is equally important as what we might think is important.
It's such an interesting point. And I think that there has been for too long this seeming dichotomy between faith and science in a way that really should not exist. And I say this to you, I'm not an ordained minister, but I am a person of deep faith. And as a scientist and physician also, I can understand why some people who, if they're unable to communicate their faith to their provider, there may be a trust gap that exists, and so the understanding and empathy is built with knowledge of where you are coming from, and so very much appreciate that. I have one final question to ask from our viewers, and I'm going to ask very quickly to Dr. Diaz, if I may, before I transition to closing comments. And that is that Congresswoman Napolitano mentioned in her remarks about machismo as one of the barriers for Latinos seeking mental health. How can that be addressed? And Dr. Diaz, I'm going to begin with you and ask you actually to work in that question, if I may, to your closing as well, which is on words that you might want to inspire our participants as it relates to mental health in the Latino community.
Okay. So in terms of machismo, it is something that's really ingrained in our culture. I have a Mexican American culture, but I was brought up I'm a first generation Hispanic, as I said, and even if my mother worked, and was a career woman herself, it was always a certain way that we were taught to view the men in the family, and so this view that we have of them builds them and forms them into feeling a certain way. As a grief counselor, right? As a person that facilitates grief groups, men don't cry. They hold it in, generally speaking, and not all the time, but they hold it in because of the way they feel around a group of people. They may show weakness. So this really does exist. It's a very real thing, even in people that say it's not, because it's ingrained. It's in our fabric. And so it comes up, it surfaces. It surfaces in family. It surfaces in the way you think, even though you may not verbalize it. And so when it comes to mental health, it comes to, a place of a man showing weakness. If again, generalizing, showing weakness, I need help. I'm back on the tequila now, and I can't put the bottle down, or I'm having to do this, or I'm having to do that, and they're afraid to ruin that image of strength. It's a fear. It's actually a tormenting fear that they're going to ruin in the eyes of the women in their family and the people that look at them a certain way. So that is very, very important. And it is very, very real. And I've talked about it many times with the Congresswoman. It's something that we run across all the time. Machismo. It's one of those things.
Right.
Yeah.
I appreciate that. And Dr. Fortuna, I'm going to ask you for your closing remarks in the last minute or so that we have.
Was that my closing?
Yeah.
Sorry. I didn't know that was my closing. I'm sorry.
Let me turn to Dr. Fortuna, and then if we have time, I'll come back to you, Dr. Diaz. There's always more to say.
Okay, well, I'll say that we can never, talk enough about all this, but I'm just going to really underline that there are a lot of organizations that are working on this issue, right, from the professional side as well as the community side and consumer side. I think it's really important for us to look at those different voices and perspectives, because there is evidence out there. There is evidence that treatment can work. There is evidence that we can work together in these creative ways. So I really just want to underline that. And so I'll be happy to provide additional resources, including, Latino NAMI, the Hispanic Psychiatry Association, that are all working on these things. And I think we need to look at that as we create our services and think about legislation that's going to have a high impact.
Wonderful, thank you. And Dr. Diaz, 20 seconds to you, if you want to give any closing remarks.
So what we did today gives me another reason to be optimistic about our efforts in mental health for our Hispanic community. It somehow broadens the vision and strengthens our hope when we can come together as a people and stay on the same page. So I myself am leaving this meeting hard pressed to do more, to do better. So in my view, we are left with several challenges, but one that stands out for me personally is to keep this conversation alive, to take what has
Great.
been highlighted and turn it into concrete action. Am I done?
Wonderful.
Y sí
I,
se
I
puede.
love.
I don't want to go over. I don't want to go over, but it's very important. I didn't, I just really want to say I'm just very excited about our time today. And I would close with this: La sangre llama, right? Bendiciones y fuerza. Para adelante. Thank you for everything.
Yes.
Thank you very much, Dr. Fortuna, Dr. Diaz, and thank you all for attending the CHCI's Health Summit. Please keep tweeting and sharing. And we have our closing plenary up next, so stay tuned for Healthcare for the Future, Advancements in Health Technology Today. Have a wonderful rest of your Wednesday.